Hi, my name is Jessica Andersen. I am a registered nurse and the Director of Clinical Performance Improvement and Organizational Excellence here at GoMo Health. Today, I'm really excited to walk through a program that we created originally with our partners, SourceWise in Stanford. And this is a proven AAA technology that increases caregivers served, decreases burnout, and improves outcomes. A little bit about our program and how we got started. Several years ago, Stanford reached out to us. They had a proposition that they wanted to test, and their thought process was there are many community business organizations in communities across the United States, all doing wonderful things to help the populations that they serve. But because they often are grant funded, there's not always a lot of additional funds available to use technology to streamline processes in an attempt to serve more people and make those connections faster. And so they partnered with us and SourceWise, which is a AAA in California, and we created the Caregiver Compass program. This program serves two main focuses. One is it serves the actual caregivers in their journey. So, specifically for this program, this is for unpaid caregivers who are caring for a loved one with a neurocognitive disorder like dementia or Alzheimer's. And the caregiver side of the program really nurtures the caregiver through that journey. Oftentimes, we think of caregivers as this sandwich generation where they're finishing raising their own children while congruently helping to support their aging parents. And during this time period in a person's life, oftentimes they're also trying to manage a job. So they are juggling a lot of different avenues. And it's important to support them to give loving care to the person that they're caring for. So, in this program, one of the wonderful things about GoMo Health programs is that there's no app to download, which is great because we know from experience that if you think about all the apps that you have on your phone, the likelihood of you going into every single app on a daily basis and getting information from that app, taking an action that the app wants you to do, it's very unlikely that you're doing that. And so we don't use an app. We send all program content through text messages. Some messages are just quick tidbits of information. Some messages, we kind of explain them as like the tip of the iceberg, where the text message itself conveys the concept. And then we'll include a link either to an external resource, which could be a national resource. It could be the client's own resources that they have on their website. Or we also have a learning management system. And so in this program, there's nurturing information, but there's also caregiver training. And based on the individual's need, all of our programs are built to scale as a solution while also simultaneously serving the individual needs of each participant. So for an example, if I have a loved one with dementia, and my loved one has trouble with activities of daily living. They're having trouble transferring from a bed to a chair, etc. I can get into this program and I get caregiver training not only for how to help someone with dementia, but also how to help somebody with activities of daily living, dressing, transferring, bathing with dignity, and also understanding good body mechanics so that I don't injure myself as a caregiver and then end up not being able to care for my loved one. And so there are training resources there, and it's self-paced. People can go into those training modules at any time of the day, whenever they have spare time, to get the resources they need so that they feel confident and prepared to support their loved ones. The other aspect of this program is for our clients specifically to help their business operations. And this program helps to automate the appointment scheduling process and decrease that time from a caregiver reaching out, wanting to connect with our clients, um, and getting those caregivers the support that they need. It also helps to have documented real-time text-based conversations with caregivers. There's been a great response to the ability of the caregivers to send a message to their case managers, that are clients' staff, and have those real-time communications back and forth when it's convenient to the caregiver who might be trying to communicate and get access to resources while they're at work and they have 5 minutes to connect with somebody, versus trying to schedule time where they can get on a phone call and have a deep conversation. Sometimes there's just not that ability to do that. So this program not only serves the caregivers, but it also supports business operations of a AAA or anyone providing caregiver support. And then one of the other things I want to talk about is the objectives and measurements of this program. So when the program was designed, one of the big key performance indicators was to decrease the mental and emotional burden on caregivers. Additionally, to empower caregivers with information and support to help them continue to provide good care to their loved ones, and to decrease the SDOH barriers to care for persons cared for. Some of our impacts. So this data that we've been able to collect through our partnership with SourceWise and Stanford has been incredible. And it has really enabled the AAA SourceWise to go and get additional grant funding because they have such amazing and impactful data. So some of the outcomes for the caregivers. There's a 74% decrease in feelings of isolation, a 35% decrease in depression, and that's based off of a validated screening tool called a PHQ-2. There's a 6% decrease in overall stress level. 81% of caregivers' need for respite care have been met through the program, and 88% of caregivers' Medicare and Medi-Cal questions were addressed. And this is a huge point for anybody that's navigating caregiving, and the spend down that happens in those later years. Impacts for persons cared for, there's a 17% decrease in transportation preventing access to care. So back to that SDOH barriers, trying to identify those and help get resources into the hands of the caregivers and the person served. And a 5% decrease in food insecurity. Again, those SDOH barriers, identifying them and getting participants support. Some other data points. 87% of caregivers reported providing regular care to an adult family member or friend. 56% of the caregivers have provided care for 4 or more years, which is quite a long time. And 42% reported providing more than 40 hours of care per week. So if you think about, again, the sandwich generation of caring for maybe their own children, having to balance a work life, and then caring for their loved one, that's a lot on the plates of any unpaid caregiver. This program uses several of the components that GoMo has in our product line. We use our care messages. So those are the text messages that go out on a specific cadence. Those are set. So each client has those messages going out. They're automated. They don't have to do anything about that. Once they're set up, they just run on their own. There's also the Care Companion, which is a learning management system, which is where we can house information. You can also have to-do list items get assigned to each individual participant's companion so they know exactly what they should be doing, and have access to the resources that the case managers identified that would be helpful to them. And the program also leverages our GoMo chat, which is a HIPAA-secure two-way chat platform where participants of the program can communicate with their case managers in real time. Topics covered in the program include caregiving caregiver empowerment, so all caregivers get that information. There's also information on respite care. So if you are a caregiver and you identify as needing help locating respite care or getting respite care paid for, there's a specific track of messages that goes out to that type of situation. There's also a caregiver stress side of the program. So at onboarding into the program, if you identify as having high levels of stress, you get messages that are tailored to your needs and helping to navigate that internal stress that you're feeling. There's also a Medicare assistance track. So if you need assistance kind of navigating the waters there with Medicare or Medi-Cal, as is in California, that track is specific to participants needing that support. And again, the activities of daily living. And that is to really help people care for their loved ones in a way that protects their own safety, but also allows for dignity for their loved ones in some kind of sometimes uncomfortable circumstances. As far as the caregiver training, there are several modules that participants can sign up for. One is the Skilled Care Provider Basics, and that just is a kind of introductory caregiving basic 101 deep dive on what to know as a caregiver. There's also a caregiver stress management, which is a deeper dive into caregiver stress and how to navigate that. There's Alzheimer's and dementia basics. So if you've never been exposed to someone who has Alzheimer's or have never cared for someone who has Alzheimer's or dementia, it's a really impactful course that teaches you the tips and tricks and also things to look out for and to pay attention to. Sometimes it's hard to even know what to expect or anticipate when you're supporting someone with Alzheimer's and dementia. So that's a very valuable module. There's also a falls prevention module, which is very important. We know statistically that falls can lead to decrease in life expectancy after a fall happens. And so learning how to take steps to prevent falls is very important, whether that's in the home environment or in a clinical setting. And then the last one is personal care. So helping your loved one take care of themselves as best as possible. There are several surveys in the program. We can use a couple different types of modalities for that. We do have a few long form surveys to identify baseline data points and follow-up data points, and also to identify what needs the individual caregiver has. We also use bidirectional messages where the text message will ask for a yes or no response. And then based on that response, the system automatically sends out a follow-up to that. The program also uses program escalations. So if a caregiver is experiencing distress, we can identify that with the program and how they're interacting with the surveys and the bidirectional messages. And if there is a escalation that needs to happen, we can route those directly to the case managers to reach out to the participant for that human-to-human interaction. Lastly, for this program, we have the ability to have reporting and outcomes. And so all of our clients have 24/7 access to a reporting dashboard. So anything that happens in the program, there is a data point that will be displayed in that reporting portal. And we work with our clients very closely to create the reports based on the data that they need in order to understand how the program is operating, see how it's impacting the lives of the person served, and also, especially in the grant funding arena, get the data that our clients need in order to go after additional grant funds. Thank you so much for staying with me to the end here as I walked through this incredible program. I'm very excited to see how it continues to help those in the caregiving space.